Hey Kelly, I wanted to talk to you a little bit about this strategy that we started talking about a little bit earlier this week. So sometimes it's helpful in order to coordinate a system. So sometimes it's helpful to see the anatomy. So I'm going to go over the anatomy and then we'll talk about how you apply this to different movements. So generally what we have here, generally speaking, when we inhale, the lungs expand and we take in air. The muscle under the lungs, called the diaphragm, actually will have to move down. And when this diaphragm moves down, it actually helps the lungs to expand and suck air in, okay? So when we inhale, the muscle that goes all the way across and basically looks like a dome ceiling off of on top of everything that's below it. That basically, when we inhale, it moves down. Okay, and then when we exhale, the diaphragm will actually go back up into position, into a more of a resting position. Okay, so that's the movement of the diaphragm. Why do we care about the diaphragm when we're talking about your pelvic floor? Well, when the diaphragm goes down, since it's serving as like a dome for all of the organs and contents of your body that are below it, whenever it moves down, it's actually going to push down or add some pressure to everything that's below it. So in your case, all of your organs plus a growing baby right now. So it's going to go down every time you inhale, depending on how deeply you inhale. So it's going to move down more the harder that you're breathing and the bigger breaths that you're taking. So, but all day long, just minor pressure on the things below. And this is normal, and our bodies can adjust to it. It's just when you're having a baby, this pressure becomes more important to manage well. So the diaphragm goes down, puts more pressure on your abdominal area whenever it does that. And then when we exhale, the lungs shrink in size and this diaphragm, the dome, goes back up to let air out of that reduced volume canister right here. So let's talk about what it does to the things below. So things below, we've got intestines, very lovely intestines. We've also got a bladder, okay? Bladder. And that bladder, well, and right now we've also got a human in here, so we'll draw a little human. Hopefully yours is better looking than that one. So the idea here is that the pelvic floor also crosses down below. And so we're going to talk about that in just a second. So if this kind of serves as the top of your abdominal dome, the pelvic floor sits at the bottom of the floor. So essentially, every time we take a breath in, we've got to expand right here, and our pelvic floor is also supposed to go down a little bit and relax, okay? So if it doesn't, so if the diaphragm is moving down and the pelvic floor stays still and says, that pressure has to go somewhere. So for women who are pregnant, how we talked about the transversus abdominis, or the linea alba, is that fascia that starts up here where your ribs meet and meets down at the front of your pelvic bone. That often, that tissue that's not contractile tissue has some recoil, but not much. When that tissue has stress on it, oftentimes it's one of the areas of give. And you've seen that before whenever you're coning. Whenever you have that little bump right there, that's showing like, oh, there's a lot of pressure and it's trying to escape there. That's where the pressure is going. So if our pelvic floor doesn't also go down when the diaphragm goes down, then the pressure's got to go somewhere. For some other women, they experience, if this is your bladder and it's full of pee, another way for pressure, another direction for pressure to go is to smush the bladder and then release some pee in order to relieve some of that pressure. And so the idea here is every time your diaphragm goes down, we want to compensate by letting our pelvic floor relax and come down. And then when the diaphragm goes back up, the pelvic floor should also recoil. So it should look like every time the diaphragm goes down, my pelvic floor relaxes. Every time the diaphragm comes back up, there's a little recoil in the pelvic floor. And so the way that we cue this is inhale, relax, exhale, contract. And so eventually, all of these contractions will be a little bit more automatic, and it won't be like doing a Kegel or anything like that. But when we first start, we're going to probably have to do a very, very conscious contraction of our pelvic floor and our abdomen when we're talking about this. But eventually, I want you to know that eventually our goal is for that to be automatic. So inhale, relax. When we inhale, we have to relax. And sometimes, we talked about this a little bit, for a lot of women who are very toned and who are very high energy and go-getters, sometimes it's actually harder for them to relax than it is for them to contract. So I'm guessing that this might be part of your issue, but we'll see. So inhale, relax. So don't even cue the pelvic floor yet. We're gonna try it just with your abdomen, so give it a chance. So we wanna try an inhale and relax. So you should feel your stomach, let your stomach go. This is hard for a lot of women because we don't like to relax our stomach. And then exhale, contract. And the muscles here that we're targeting for this contraction are actually the transverse abdominis. So let's talk about that for a second. So we've got a couple layers of muscle in our abdomen. We're gonna talk about two. The most superficial are the rectus, and these really don't help much for this type of breathing that we're doing. So these are the ones that we're often most connected to. So their fibers run this way, so they help us crunch in amazing ways this way. We're actually trying to cue the deepest core muscles, the transverse abdominis muscle fibers, because these actually run around this way. Okay, so the thing that we can do to try to cue ourselves there is to find your hip bones, and then put your fingers on the inside of your hip bones and give a good inhale, relax. Exhale, contract. We should be feeling a little, some contraction here, and we should see the contents of your abdomen come in a little bit, because that's the function of that muscle, is to contain and stabilize us. So we'll know that we're getting the correct muscles if you feel that contraction and you kind of see your abdominal contents come in. I'm not asking you to squeeze the baby intensely or anything like that, but just feel that, okay, can I bring the contents in and can I relax? Can I bring the contents in and relax? And then contract. Okay, so inhale, relax, and then exhale, contract. So this contraction isn't like, I don't want you to act like you're doing a maximal contraction here, but are we able to contract the pelvic floor while we are contracting the rectus abdominis? And that might take a while to coordinate, but it's worth the time to try to coordinate those two things. So a lot of people use the cue, like pretend like you're trying to pick up a blueberry with your vagina. So what we're trying to do is make sure that you're actually contracting up and in, which not everybody actually does that when they try to Kegel. So we're going to inhale, relax. Relax abdomen and pelvic floor, and then exhale, contract both abdomen and pelvic floor. Okay, so I'm gonna let you practice that. Inhale, relax, both places. Exhale, contract. Okay, so if you want to stop this and practice that a little bit, that's understandable. Okay, so that's the first part. That is a really fast rundown of something that's actually really complicated for a lot of folks. So don't feel like you have to learn all that information in one session. It's hard to learn. But I just want you to have this resource so that you can come back to it once you're feeling more confident about the coordination of all of this. So practically, what does that look like? Practically, what it looks like for now, and because you're not having many symptoms, we're going to practice this breathing with your movement as sort of a way to prehab your postpartum time, to make sure that the symptoms, which were more likely then, won't start popping up then. So this is what it looks like whenever we do even just like a goblet squat. So we're going to actually inhale and relax on the way down, and exhale on the way up. And there's different strategies that we can do if you're feeling terrible or really good and ready to move on to something else, but this is just the most basic one. So we're going to relax, so we're going to inhale, and then exhale, contract. Inhale, relax, exhale, contract. Okay? And then the deadlift, we're actually going to do a little bit of the opposite. So we're going to, whenever we're putting the weight down, we're going to inhale, relax, and then exhale, contract. Inhale, relax, exhale, contract. So this is trying to essentially take advantage of the contraction of the transverse abdominis and your pelvic floor on the most difficult part of the weight. So, or on the most difficult part of the movement. So for squat, for a lot of people, this is the easier part, not saying that it's super easy. And then the hardest part is coming up. And that's where we want the extra pelvic floor support. That's when we want the extra abdominal support. And we don't want to over cue these things or work them so that they're contracting the whole entire time, because that can sometimes cause leaks. But we can play around with it, whether or not you're having symptoms. We can deal with that now or later. So this is just a general strategy and a way for us to introduce all of this. So wrapping it all up, the idea here is to manage your pressure well so that the pressure stops bubbling forward, and so that we're managing our pressure well this way. Your pelvic floor is giving us a chance to manage some of that downward pressure from the diaphragm, rather than that pelvic floor saying, I'm staying in a contraction the whole time, which is what a lot of women do, and that diaphragm goes down, the pelvic floor never moves, and so that pressure goes somewhere else. Like I said, it can cause leaks, or it can cause some worsening of the diastasis. This is not anything to be neurotic about. Like I said, we're catching this early, so play with these strategies, and then if you start to have more symptoms, we can cue in, we can look at that and see if there's something else that we can do. So there's lots of strategies, this is just one. So I hope this is helpful and not too much, and we'll see how it goes when you're practicing in the gym.